Today, we are going to learn about rehabilitation of spinal cord injury. Spinal cord is the continuation of the brain and means of communication between the body and the brain. The nervous tract extends from the brain into the spinal cord and then spread through the network of nerves throughout the body. Through the network of sensory fibers spread in the body, spinal cord sends the sensory information to the brain. These fibers enter the spinal cord at different levels. There are nervous fibers that runs up and down in the spinal cord. The levels from where motor fibers spread out and sensory fibers enter the spinal cord are called spinal cord roots and are very important to understand the implication of spinal cord injury. Causes of spinal cord injury. There are two types of injury, traumatic and non-traumatic. Motor vehicle crashes, falls, acts of violence, sports injuries are under traumatic injury. Case of cancer, infection, intervertebral disc disease, vertebral injury, spinal cord vascular disease, osteoporosis or arthritis are under non-traumatic injury. Types of spinal cord injury. The American Spinal Cord Injury Association's International Standard for Neurological Classification of Spinal Cord Injury measures the level of spinal cord injury based on the sensation the patient can feel and motion they can perform. There are two terms you should know in this topic, dermatomas and myotomas. Specific areas on the skin that are selectively innervated by only one nerve root are called dermatomas. The group of muscle innervated by single nerve root are called myotomas. Specific movements are suggestive of these myotomas. Symptoms at different levels of injury in complete spinal cord injury. Cervical level injuries, thoracic level injuries, lumbosacral level injuries. Symptoms of incomplete spinal cord injury are central cord syndrome CCS, Brown Sequard syndrome BSS, it's also called hemicord syndrome, anterior cord syndrome ACS, cauda equina and conus medullaris syndrome. Therapeutic rehabilitation should be effectively delivered at the beginning in an acute care setting at the time of injury. Neuro-rehabilitation. Inpatient rehabilitation begins during the critical and acute care stages after an spinal cord injury. The primary emphasis of early rehabilitation is to lessen the adverse effects of neurotrauma and immobilization. This focus may last from a few days to several weeks, depending on the severity and level of injury and other associated injuries. During the acute phase, patients may begin participating in early therapy that should include respiratory care, prevention of indirect impairments and complications, range of motion exercises and initiating active exercises in available musculature, normalization of tone, early strength training, gaining upright tolerance, out of bed activities, sensory reduction, skin management education. So another one is taking home massage. There is specific recipe of treatment for patient with spinal cord injury. Whole innervation plan comes with appropriate reasoning and justification based on your assessment and examination. So thank you for listening.